Greetings. A very warm welcome to all of you, and our heartfelt thanks for joining us today as we attempt to shed light on matters that naturally have elicited great public interest as we continue to confront the unprecedented challenge that COVID-19 has presented us. We have titled this webinar, Communicating Effectively During Pandemics, and my panel of eminent personalities whom I shall introduce as we go along will give us their considered opinions on this matter, which I'm certain you will find extremely illuminating. Just by way of some housekeeping, before we begin, we will have a number of presentations, each lasting roughly 7 minutes, and a question and answer session at the end. So kindly put in your questions as we go along, and we'll sample as many as we can at the end of it. Please write in, we'd love to hear from you. And please also note that a recording of this session will be available on demand. And we will also be running a small poll, so kindly participate in that poll. And we would also appreciate your views on an evaluation of this presentation, and we'll be asking you at the end of this to write in via email just to give us a sense of what you felt about this session. To kick us off, allow me to invite the Infotrak Research founder and CEO, Angela Mbitho, to present some rather interesting findings that will set the stage for our discussion today. So welcome, Angela.
Thank you, Walter. Good afternoon, everyone. Understand the context in which we are, conducting this, very interesting webinar. the context with which we are, conducting this, data over the past couple. And hopefully this information will help, the panelists and also the audience, the country, based on the research that we've conducted. So let me start off by saying that COVID-19, the 7% say it's a key issue for government to deal with. And we see that an overwhelming majority, 81%, are extremely worried about the COVID situation in Kenya. They are, another 64% are more worried about the COVID situation now than before, especially because we can see that there is no end in sight. And then we have 34% saying we are currently experiencing the worst. 28% say the worst is yet to come. And then you see that almost 9 in 10 Kenyans are quite worried about whether or not they have the coronavirus. And they feel that many people have the virus but don't know they have it. And then 88% are very worried about how they will make ends meet. So, what is this coronavirus presenting? Personal health, personal finance issue, or both? And we see that another 76% are worried that we don't have the capacity as a country to deal with a widespread pandemic. If we move on, then we also see that, right now, the coronavirus is perhaps perceived to be more a personal finance issue. You see there that in April, the coronavirus was perceived to be more a personal health and personal finance issue. But when we did the second wave around June, late June, then we see that right now, coronavirus is an issue, but it's perceived to be more a personal finance issue. And I think that's a critical point for communication specialists to understand that, yes, we know that it's a problem. We are worried about the pandemic, but if we stay home, how do we make ends meet? If we can't do things the way we normally used to do them in the past, how are we going to feed our families? And then we see that 35% say it is both a personal finance and personal health issue. Just to give you more insights, you will see that 87% of Kenyans say the cost of food has gone up, so they're finding it harder to feed their families. 75% cannot remit money to their dependents back home, which is something that most of us, as you well know, do. 75% have been able to, pay our loans, and we all live on one loan or another, whether it's formal or informal borrowing from our friends and neighbors and relatives. And then 68% aren't even able to adequately pay for gas, kerosene, and charcoal. We also see that majority are not able to comfortably pay for their normal utilities. And another 67% say they couldn't even buy medicine. The rent crisis is a real crisis in the country right now, with 63% unable to pay rent on time. Urban dwellers saying they're, 74% saying they are unable to pay rent on time. And we basically see that 54% of Kenyans have had their salaries reduced by one way or another. And then we see that the incentives that government has tried to put in place, like for instance, the reduction of VAT, is yet to really benefit the common man. You look across the board from Northeast and all the way to Nyanza, nobody really is feeling the effects of the VAT reduction. And now when we look at the psychological effects of the pandemic, then we see that majority, 81%, are feeling very stressed and anxious about what is happening. 68% feel confused about what is happening, and 61% feel quite lonely. 52% feel helpless, and 36% feel mistreated, while we have another 33% who feel angry. And we also have, maybe you're part of that group, the 36% down there of Kenyans who have had a hard time sleeping due to the pandemic. Are they following news closely? Well, not as closely as they used to before. The news on coronavirus has become something that is more stressful and alarming as opposed to what it used to be. So you see that, 78% say that the news is actually stressful and alarming. 48% also mentioned that the news is confusing, is complicated, and we also see that 49%, almost half of Kenyans find the news on the coronavirus boring and repetitive. So that then gives us a sense of the psychosocial level and state in which Kenyans are right now. And the questions abound are, if that is the mindset of the Kenyan, the typical Kenyan public, then how do you communicate with them in a manner that is effective, that is not fearful, that is not stressful, that is not boring? What we would like to very quickly share with you right now is an additional qualitative study that we did on select ads. So against the backdrop of what I've just shown you, we now just want to take you through the journey and show you the ads that have been, airing on our TV stations, and then, show you what respondents actually felt about those ads. Walter, Derek, over to you. Yes.
Apologies for that. Come on, please. Play. So apologies for that. Now, yes, we indeed will be playing the ads, but I think it is important that we go through the just a breakdown of the findings with respect to the ads. And what we find is, in terms of the so in mid-March, when the outbreak was reported, there was a lot of fear and anxiety amongst Kenyans. The government of Kenya and other organizations launched communication aimed at testing and sensitizing Kenyans about the COVID-19 pandemic, and the sensitizing came out in form of adverts and communications aired on various media outlets, which we will share with you right now.
I think I can take you through as the ads are being loaded, I can take you through what the findings were. And so we looked at a couple of ads and we said that, let's look at ads that are from private sector and ads that are from government, and look at the engagement, the credibility and believability, the relevance and appeal, the persuasiveness, the ease of comprehension, and uniqueness. And what we found is that there was no one-size-fits-all solution. So that when we looked at the government ad, it was top in engagement. It was, second in credibility and believability. But in terms of relevance, appeal, persuasiveness, and ease of comprehension, it was third in that advert. When we looked at the other ad that we picked, which was Dettol, then we found that the Dettol ad was found to be quite engaging. We see that the Dettol ad ranked third and fourth in relevance and also in persuasiveness. We looked at the Safaricom ad because the Safaricom ad was actually a very well executed ad across all media. But what we did find is it ranked third in engagement, it ranked fifth in credibility and believability, but it was found to be the most relevant and the most persuasive, and second in ease of comprehension and uniqueness. We looked at another ad that was talking about Corona, that's the Imperial Leather ad. It wasn't, top in engagement. It was fourth in engagement, but it was found to be very credible and relevant, and also very persuasive. However, in terms of ease of comprehension and uniqueness, it was also not found to be, that comprehensive. And then there was a Lifebuoy ad, which I think most of you have seen, that was also perceived to be easy to comprehend, but then not as engaging, credible, or relevant and unique as the other 4 ads that I have mentioned. So, with that having been said, the questions then, are the same as the ones that I posed before, which are, with everything we have going on in our minds, are these ads really communicating what they have to communicate? When the respondents were talked to, they actually talked about the ads trying to be self-serving in one case. The government ad, on the other hand, was believed to be, something that was for public good, but was all over the place. So the messages were lost out because it was communicating so many things at this. I can obviously now perhaps go back to one of the things that we posed to you when we talked to you the last couple of days and asked you, are you tired of the coronavirus? Well, what we found out from the research, what you've seen is that pandemic has affected many people across the globe. The COVID-19, people are tired of washing their hands and sanitizing their hands all the time, wearing masks, social distancing. And what does that mean when you talk about urban slums? What is social distancing? And also, how do you stay at home and fend for your family? Yet, now more than ever, as the CAS will tell us, we need to stay at. Thank you very much. Walter, back to you. We can now introduce the panelists.
All right, thank you, Angela. So, our first panelist perhaps needs no introduction, having become a regular fixture on our TV screens. Fanatically positive and militantly optimistic. Dr. Mercy Mwagangi works at the Ministry of Health as the CAS, a role in which she supports the Cabinet Secretary in providing oversight and stewardship in the implementation of health sector policies and in building collaborative partnerships with a diverse range of sector stakeholders. She has contributed to the design and implementation of the Universal Health Coverage Pilot Program that form part of the Big Four agenda. And she holds a master's degree in health economics and policy from the University of Adelaide in South Australia. Welcome, Dr. Mwangangi.
Thank you. Thank you so much to members from Infotrak for creating this platform today for us to share our experiences when it comes to COVID-19, and in particular, how to communicate appropriately to share messages and execute behavior change. We have prepared a few slides for you to be able to give you some background as to how we are currently rolling out the interventions in the country, how we structured ourselves, and how we see our approach evolving as we continue facing this epidemic. Next slide. So when it comes to COVID-19 response setup and how we've organized ourselves, it's important to note that the oversight committee and the committee that provides overall direction in terms of our way forward is the National Emergency Response Committee. And this committee is chaired by the Cabinet Secretary in the Ministry of Health and constitutes of participation by Cabinet Secretaries from the Ministry of Defense, Transport, ICT, Education, amongst other line ministries, departments, and agencies. And through this approach, in terms of how we've organized ourselves, we've put in place technical task groups below this committee. We have, of course, the task group that deals with risk communication. And that's a task group that is collaborative in nature, having participation of both public actors, state actors, such as the Ministry of ICT and Health, but also having a very huge component of private sector engagement and participation, particularly MSK and the National Business Compact against coronavirus, all who've been really helping us when it comes to our communication messages. We have then the Emergency Operations Center, and that's sort of the nav bit when it comes to our coronavirus response. And this is where our teams deploy rapid response teams who are able to execute testing and also contact tracing. We have a team that deals with facility preparedness, another that deals with case management, and these teams essentially come up with the different protocols that we've been churning out in terms of our response. When it comes to putting in place protocols that deal with the severity of the disease, when it comes to protocols that deal with the different kinds of medications that can be administered to our COVID-19 patients, when it comes to protocols that deal with quarantine centers, when it comes to even opening of schools. These are the teams who are working hand in hand with all the players to ensure that our protocols are in place and are executed. We do have a resource mobilization team, and this is the team that combines together all the resources that we've received when it comes to the COVID-19 pandemic response. And they're able to ensure that the deployment of the resources is rational and goes to most priority need areas. We have a team that deals with capacity building, and primarily this team is involved with ensuring that our healthcare workers are well trained, as well as other frontline workers, to ensure that they're able to execute their mandate in terms of COVID-19. And then of course we have the community engagement team. This is the team that really is in the grassroots, working with all the different players when it comes to the community, working with our CBOs, working with our community health volunteers, working with the Ngao structure, working with the Nyumba Kumi structure, to ensure that our messaging, our communication, our messages on adherence are actually fulfilled and implemented at the community level. Next slide, please. In terms of a snapshot where we are today, in terms of response, we are in the 5th month of response to COVID-19. And it's important to know that our response continues to be dynamic. We continue to re-examine the system level in terms of its preparedness, in terms of its resilience to the current workload and burden, in terms of emerging priorities and levels of preparedness. And in this regard, as at yesterday at least, we'd been able to run about 3,000 tests and with a resultant 440 tests coming out as positive, bringing our caseload to around 17,000 in the country. And in terms of our recoveries, we have our numbers here, and we have our case fatality rate at 1.6%. Now, when I was preparing for this and, just trying to reflect with regards to how we've been communicating as government, I've often heard people say, sometimes the numbers do not make sense. What does it mean when we say today that we have 440 out of 3,000? How does that impact Wanjiko's life? How does that impact Mercy's life when we say that, our caseload is now 17,000? And so, even as we go forward and as we try to revamp our communication, we are going to try and perhaps highlight more what it means when we say in Machakos County, after having tested 40 people, 3 are positive. What is the implication of that to you who lives in that county? And I think perhaps these are some of the nascent elements of communication that we'll be discussing today, sharing the journeys that we've had, sharing the challenges that we've had, and how we intend to proceed forward. I would hazard to ask Angela on here today, what does it mean when we say that we have a case fatality of 1.6%? What exactly does that mean for a country of 40 million Kenyans? And this is a statement that we repeat every day during our press briefings. And so we are hoping that today's discussion will really perhaps, help us to come up together with, a more nuanced approach when it comes to communicating some of these issues and ensuring that we relay the message. When we say 1.6%, is it that bad if it's 2%? If it moves down to 1%, is that a good thing? And so these are the things that we'll be sharing today. Next slide. This again is a depiction of our caseload summary. And I've often heard people say, are we cooking figures? Are these figures real? Where are they coming from? Are we flattening our curve? How does our curve look like? And perhaps again, to learn from lessons and perhaps challenges that we faced. Currently, this is how, our epidemic curve looks like if you plot it against the past weeks that have gone by. And if you look at this, in here is already perhaps 5 or 10 stories that are really important for the citizenry to learn and understand what it means when it comes to the COVID-19 fight. If we look at the yellow bar, perhaps that would be the most promising of news, or news items that should be captured, is that continuously, we continue to maintain about 90%, 89 to 90% of our patients being asymptomatic. And I know we've repeated this in previous briefings and we've mentioned it, but sometimes it becomes important to really ensure that this message then therefore is well understood. While it is a good story that 89% of Kenyans are asymptomatic, it also means that out of our 17,000 cases that we have to date, 89% of them, despite testing positive at one point or another, exhibited no symptoms. And it means potentially that we had 89% of us being able to actually transmit this disease. And so really, I do agree, with the findings from the Infotrak, study, that it becomes important for us to communicate a little bit better, to allay fears, but to also have the citizenry engage with the evidence and the data in a manner where they're able to make inferences that, give them the knowledge that they need, knowledge especially that helps in terms of adherence to the containment measures. Next slide. We've tried to put together, bits and pieces of our approach and how we categorize them in terms of, the interventions. And, we've had a lot of hue and cry in terms of the different interventions put in place. I think most recently, yesterday in the 5th Extraordinary Summit, the President was able to put in place new interventions and new restrictions, particularly when it comes to alcohol. And perhaps then it would be important, as part of this communication agenda for us as government to come out forward and to explain to the citizenry, why was it deemed necessary to put this restriction in place? What is that, causal effect that alcohol has when it comes to containment measures? How many other countries have practiced this as a global best practice? And perhaps again, through the medium and tool of communication, we would then see better adherence. We would then be able to see us, actually be able to impact the curve as it stands. So as we put down our interventions, we are well aware that some of these interventions have repercussions when it comes to governance, when it comes to social and economic development, when it comes to disruptions in terms of the different income levels that we have in the country. Well aware of that, but again, communication is a methodology that can be used to bring that understanding of the citizenry, but also help in terms of identifying where can you get support should you need it, and where are you able to plug in terms of supporting the current response agenda. Next slide. Again, here to just demonstrate really, for each and every intervention that we've put in play, we've often, had to really quickly come up with ways of communicating it and ways of actually ensuring that these measures are adhered to. And as we reflect on, the role of communication, it becomes important, particularly and I'll just jump onto the home-based care protocol. When we launched this protocol about 4 weeks ago, it was actually launched, and I think Kenya is one of the pioneer countries to be able to put this together in an attempt to ensure that we do not overwhelm our health system. And we've had some remarkable successes with this program. We actually have different people, a set number of people enrolled in the program every day. And we also have good recovery rates, again, from the home-based care program, and with actually 0 fatalities to date. But one peculiar thing that came out as we rolled out the program, and even as we, made attempts to ensure that we communicated to the citizenry in terms of what home-based care means, is that we still have, from our social media surveillance activities, from listening onto our radio stations and what the population is saying, most people don't understand what exactly is a home-based care program. How do I get enrolled into one? What does it mean then, if you're telling me that I'm unwell, but I have to stay at home and that is where I will get my care? How do I take care of myself? What do I do if I'm living with, different family members in this program? How do I segregate, how I live with them to ensure that they don't get infected? How do I get discharged out of a home-based care program? So indeed, there's, numerous areas where, communication is perhaps central, and really, the word, the sort of focus word in this COVID-19 response has been that for the first time, we're dealing with a pandemic that really has non-pharmaceutical interventions. In the health sector and as doctors, we're very used to really just giving a pill and a jab and, hoping that will take care of things. But for the first time, we're dealing with, non-pharmaceutical interventions such as risk communication as one of the major pills when it comes to managing COVID-19. And so really, again, a very central role that communication plays. Next slide. Next slide. Again, another key area when it comes to contact tracing. Often we've had people ask us, I'm now positive, how will you reach my contacts? How will you engage with my contacts? Which number do I get called on to when, someone is tracking me and I'm a positive, or I've had close contact with a positive? Again, another pivotal area where communication comes in. And I dare say perhaps, with the Infotrak team that is on here today, it would be interesting for you, to perhaps roll some polls that really ask people, what number do we usually call you with when we're doing our contact tracing? How many Kenyans actually know where the COVID treatment units are in their counties? If I ask Mr. Marube here, where is your nearest CTU? That's a huge element of communication. And really, again, areas where we can partner and have, some form of partnerships in terms of trying to really push this message to the citizenry. Next slide. Let's scroll down, please. Next slide, please. Yes. So just to sort of get to the end of it, in terms of where we are and what we see moving forward, what we're clear on is that in terms of, approaches, no one set approach is deemed to be correct. Countries do have to adopt different approaches. And when it comes to communication, one of the biggest lessons that we're learning is that communication really should adopt a bottom-up approach. It becomes very important to understand the community, their perceptions and their understanding, the culture, to be able to actually tailor-make a message that's able to reach them, a message that they're able to understand, and a message that is able to convey, the intent in terms of the different interventions. Taking reflections back and trying to see perhaps another area where we would require to focus a bit more on is on the linkages between communication and evidence. I'm quite pleased that we have partnerships with Infotrak and we also have partnerships with USAID and different other development partners who are working with us. But it becomes important to find a way of coalescing all this together to ensure that those clear linkages are communicated. I'm sure you've all seen the video that's passing around this morning on hydroxychloroquine. And whether it's effective when it comes to COVID-19. And what is interesting is that we've actually been able to communicate this in our previous press briefings numerous times on the efficacy of that medicine, on the trials that have been undertaken, communicating that as it stands right now at the WHO and even in Kenya, that drug has no effect when it comes to COVID-19. However, I must say, perhaps since morning and since last night, I've been fielding calls from different, members.
Dr. One more minute, please.
Sorry, yes, and members everywhere asking on the efficacy of hydroxychloroquine. So really, again, another element where communication becomes extremely important in terms of trying to ensure that messages are passed on to the population. I think I'll close at this point and be able to engage more in the chat session and during the plenary session. Thank you.
Thank you very much, Dr. That was eye-opening. I'm sure our viewers will agree, as well as the panelists. So I'll just give the next opportunity to the following panelists. That is from the Council of Governors, Madam Jacqueline Mugeni. Madam Jacqueline Mugeni is the CEO of the Council of Governors. She's an advocate of the High Court of Kenya and a human rights specialist. She holds a master's degree in international studies from the University of Nairobi. She's the chairperson of the East African Women Lawyers Association, a board member of Senior Women Citizens for Change, a member of the LSK, as well as the International Commission of Jurists. She was a member of the Transition Authority and has worked as the chairperson of the Legal and Intergovernmental Committee. She was also the Gender and Advocacy Development Advisor at SNV Development Organization. And Jacqueline has vast knowledge in devolution and is passionate about promoting women and children's rights. Karibu, Madam Jacqueline.
Thank you very much, Infotrak, for the introduction. I can't see your name. I'll just run very briefly on what the issue about communication and how county governments are communicating on the issue of COVID. Thank you, Cass, for setting the ground. As you all know, the county governments take their cue from the national government because, as the law says, a national pandemic is managed by the national government. So what Dr. has presented, the protocols that they develop and everything, actually they're implemented at the county level. And so I'll present just what it is that counties are doing. We had already sent you the presentation, but I see we seem to be having a technical challenge. So I'll just move through so that we don't spend too much time looking for it. As I already said, health is a fully devolved function. And so as we face the pandemic, we have been working closely with the national government and other stakeholders in the fight against COVID. And so far, as at yesterday, when we were going for the summit meeting with the president, it was only 44 counties, but as of yesterday now, we are at 45 counties. Baringo has joined. And so for the past 20 weeks, the council, through the chairman, Governor Paranya, has been communicating what the counties are doing from a perspective of informing the country on how prepared they are, but most importantly, what they are doing in relation to each county government and what they are tackling. So every Wednesday, the chair of the council provides information to the public, consolidated from all the 47 county governments and what's happening, but also looking at some of the challenges that are there. So in terms of communication, what counties are doing at community level, at village level, they use the community health workers and the community health volunteers, and they've attached them to households. And they're the ones who sensitize the people at community level. These community health workers have also been trained, the CHVs, they've also been trained about giving information on how to handle issues of COVID. And so as they go to the communities, they speak in their vernacular because we know that there's a high level of illiteracy, especially within the country. And so they communicate using vernacular and try to pass across the messages. We are also using leaders at the community level, such as the elders and the chiefs. We work together with the health professionals, and they're also trained and sensitized. We're also working with the structures that Tari has spoken about, the county commissioners, the MCAs, the local leaders, through various mechanisms. We are aware that markets did not close, but we just encourage counties to implement the social distancing within the markets. And so when we don't do the open air market days, but when the markets are there continuously because of provision of basic needs. So whenever that happens, during the markets, people go around and just sensitizing people, saying, move a bit away from there. This is where you have been demarcated to be in. Sometimes it works, sometimes it doesn't because of the obvious reasons. We also utilize the Nyumba Kumi initiative. So some of the steps that we have taken to ensure effective communication, I think I'm on slide 5, if somebody is managing it. In order to broaden communication, counties have done the following. They also participate. We encourage the CCs and the CEOs to participate in the media platforms, such as of course, TV, but mainly FM stations, because a lot of the FM stations communicate in vernacular, in a language that people understand, and then they allow the communities to call in so that they can be able to respond to some of the questions, to respond to some of the daily briefs that are coming in from the national level, so that they can be able to ask questions. And the CCs, the chief officers, and even the directors of health are able to respond to this. Sometimes governors also take opportunity to brief their populace through the FM stations. The press updates by the governors on county preparedness are also some of the interventions that governors give. Then, of course, we have informational videos by the county leaders on preventive measures that are done mainly in vernacular. And then, of course, the usual, the young people within counties have invented their own media platforms. But what we seek from the county directors is to ensure that the information that is being communicated is really factual. And some counties have also put up billboards, some banners in the streets, and also some IC materials that come in from the national government, the posters. Although, of course, the challenge we've had is about the issue of translating them. Then the other one is for every governor, whenever they do the briefing, we encourage that they use the sign language interpreters during the media briefings. And also we mobilize the public address systems at the sub-county and the common spaces so that the public is sensitized through those common spaces. Every county government has put in place a hotline where if somebody is positive and is at home, they can be able to call so that they can be collected. But as we know, sometimes it gets overwhelming, and sometimes the hotline is picked, sometimes it's not picked. So those are some of the challenges that the communities are saying when we do the FM station calls. They say, I called, nobody came to pick me, and I'm here, I'm still waiting, or there's a death that has happened, we've been waiting for so many hours for the body to be picked. Then, of course, there's the issue of the translation of critical information on signs and symptoms, and the issue of prevention, among others, into at least 15 vernacular languages in Kenya. They've translated. So, of course, there's still more to go because we know the numbers that we have in the country in terms of the vernacular. So what are some of the challenges that counties are experiencing? So despite these efforts, all county governments have continued to face similar challenges in form of laxity and compliance of the laid down guidelines by the Ministry of Health. Yesterday when we had a meeting, most of the governors were saying enforcement is very hard. And even the president said, you see, we can't enforce communication and issues that have been communicated to 47 million Kenyans. We don't have that number of police officers. And also this is not a law enforcement issue, it's actually a health issue. And so it's difficult, but people are being encouraged to be now each other's keeper and actually speak to the issue of ensure that in your environment, as the president said yesterday, you are enforcing the rules as an individual. And if somebody enters a shop and they don't have a mask and you're there, you either move out or you tell the shop person, this person has to wear a mask. So that's what we seem to be agreeing on, so that it's at person-to-person level. Then, of course, the communication materials that have been developed by the health experts in English language have limited words in vernacular. Somebody was asking, what is comorbidity? And I said, I'm a lawyer and I don't even know how to translate that myself. I don't even understand it. So how do you say that in Luo? How do you say comorbidity in whatever? So sometimes it uses many words, and I don't know whether in the use of the many words, you might lose the word that you're trying to communicate. So I think there's still a struggle to get the right language in which to communicate, and also how to translate the words in a way that is simple, that can be understood. Then, of course, the issue of using messages that have caused fear among the members of the public. Dr. Mwangangi was presenting and saying, when you say 1.6% is dead, for us within the counties, as people don't see 1.6, they just see people are dead. That is the message that they get. So I think there's a challenge in finding the right language that can be able to encourage people not to be fearful. Maybe using, like we was proposing, maybe using the language that is now being used to promote HIV/AIDS awareness, because when it started, it was the fear, and then slowly it changed into now people understanding and knowing that what they need to do, the ABCs. Then, of course, using messages that members of the public find hard to relate to is another challenge. Because all we tell people is now we have closed, now you have been told not to go here, without really giving proper explanation, and Dr. already spoke to that. Lack of simplified home-based guidelines that the public can understand. The public has been told about home-based quarantine, and they have not been, the guidelines do not provide information on how, like now the one that we have simplified does not say at what point, who comes to certify that now you can be released. That part is missing, so there's a bit of some gaps in the communication. So what are the proposals that we are making? That we need to use disaggregated data to develop targeted key messages that look at age, gender, culture, and social class, because people are in different spaces. Then we also need to broaden sensitization and strengthen social and cultural structures as COVID-19 behavior change agents. We have the women chairmas who are always meeting. We have the village barazas. We have border associations, youth groups. Today we are meeting with the border associations, and I was very impressed. They said they've been monitoring and there is no death and mortality that has been reported of the border riders. And I actually asked my team, could we follow up to see whether truly this is true? Okay, of course I'm not doubting, but I was very impressed and I wanted to know how come, yeah, not that they were supposed to die, but how come? So maybe there's something that there's a way they are communicating with their people, which we don't know. It could help us to communicate better. And then, of course, use of influential personalities and enhancing awareness. We had our own challenges, of course, with our political leaders, until the chairman of the council himself had to come out and say, politicians, we are not immune to this. So I guess yesterday the president re-emphasized it. So I think it's important that this begins to come out. And the other intervention that we propose is that we need to also speak to the issue of stigma, which people are struggling with, because when people come out, they are stigmatized and there's fear around. But if personalities that we in Kenya regard as high came out and said, yes, I went through this and it's okay and you can be able to survive it, it will help a lot. Then, of course, we have the issue of consistent, effective messaging from leaders and authorities. both for formal and informal, including law enforcement, social, cultural, and religious leaders because of the opening of the places of worship, using communication experts in developing key messages like Infotrak has said here, that demonstrates both scientific in a way that is simple and social approaches. And of course, partnership between county governments and broadcasting stations to train and sensitize Kenyans on the pandemic through their own programming so that we don't have to introduce new programs. We just use the existing programs. And of course, develop a relatable ABC on home-based care the way we did for HIV/AIDS. So then, as I conclude, I just reiterate that we are following the guidelines that have been provided by MOH, all of us, and we should, of course, continue to heed. It's my hope that this webinar will help us to establish proposed guidelines that will enable policymakers and the private sector speak from the same script, like what we had today with the transport sector, the industry. They are very, very vibrant, and I was very impressed with what they are doing, the Matatu people and everybody else. And let us also be our brother's keeper, but let us allow spaces where people are able to communicate their fears. Holding similar webinars like this ones, even with the communities, it doesn't. So thank you very much.
Madam Jacqueline, one more. Okay. All right. Thank you, Madam Jacqueline. Thank you, Madam Jacqueline. Now, I'll allow, we were meant to play a segment earlier before, so I'll just take some time to have that session. So I'll just invite Angela to take us through the session on the ads very quickly before we go to the next panelist. Thank you.
Thank you, Walter. Thank you for giving me another opportunity to speak. I had so many people asking me why they couldn't hear me. I hope I'm clear now. I was meant to just set the stage with regards to providing, an overview of what our researchers have been saying with regards to the coronavirus pandemic. And so if we actually look at, what Kenyans are saying today about corona. Derek, I hope we're on that slide. We see that 47% of Kenyans feel that the COVID-19 and coronavirus issue is still the #1 issue of concern for most Kenyans, and they want government to deal with it. So I'm glad that both Mercy and Jackie are here to send back that message. And we also see that an overwhelming majority are currently very worried about the situation, 81%. We have another 64% who say they are currently more worried than before about COVID-19. And then you have 34% who are saying that they are currently experiencing the worst of COVID-19. And then you also see that there are about 1/3 of Kenyans who feel that the worst is yet to come. But even more importantly for government and all the stakeholders and people who are in this webinar to know is that if you are feeling that you may have coronavirus but don't know you have it, you fall within the 9 of every 10 Kenyans who also think the same way. So that 89% of Kenyans are worried that they may have the virus but don't know that they have it. And then there is the question, and it is abound. Your health is critical, but you also need to ensure that you have a livelihood. So there's always the question of life versus livelihood. And 88% of Kenyans are basically saying that they will not be able to make ends meet should the pandemic persist. And you see that another 76% are worried that Kenya doesn't have the capacity to deal with a widespread pandemic. We also see that whilst in the initial stages, when the COVID-19 hit us in March, when we asked Kenyans, the issue of COVID was both a personal health and a personal finance issue because we had been asked to predominantly stay at home. So 63% thought that. But when we did the same survey about a month later, then we see that it has now health has been overtaken by finance, and more people actually see, corona as a personal finance issue as opposed to both a personal finance and health issue. You can see that there at 41%. What are the other things that Kenyans are feeling in terms of the economic and financial challenges? Well, there are many, and I think it's important for communication specialists to understand where our mental state is, our financial and emotional state is, so that when you're communicating with us, know that this is not the only thing that we're thinking about. We're thinking about those of us, 87% of us, that the cost of food has gone up. Another 79% of us are thinking we can't send money back home to our relatives and our parents. We also have about 75% who say we are unable to pay our loans, whether it is to friends and relatives in the informal means or in the formal way to the bank. We can't pay for, or we can't buy kerosene, gas, which is a basic necessity. And we see that 67% say that they are not comfortably able to pay for utilities like electricity and water, neither are they able to comfortably pay for medicine. And then the rent crisis is also real. And we see that majority of Kenyans are either unable to pay their rent on time, 63%, 74% of urban dwellers saying they are not able to pay their rent on time, 60% say, nationwide say they are not able to pay their rent in full, and urban dwellers, 72% saying they are not also able to pay their rent in full. More than half of Kenyans, 54%, have also mentioned that they are not, earning their full salary. It has been slashed in one way or another. So the financial pinch is real. And to make matters worse, some of the incentives and initiatives that government has put in place, like the reduction of VAT, which is meant to benefit the common man, is yet to be felt. So whatever cost reductions would have been accrued from that are yet to be felt. Psychologically, COVID has also, placed a lot of pressure. You see that 81% of us are feeling more anxious and stressed about what is happening. 68% are feeling confused about what is happening. And 61% feel lonely. So it is not surprising that when we had the president yesterday talking about restaurants and eateries, I think it is because people feel so lonely that they tend to go out to meet and to socialize, because as it is, or as it were, we are social beings. And then 52% feel helpless, 36% feel mistreated, and we have 33% who are feeling angry. And if you yourself in this webinar have been unable to sleep, then you are among the 4 in every 10 Kenya who have felt, have had problems or experienced problems and a hard time sleeping during the pandemic. Are we following news on corona as closely as we were in March and April? Not quite. Why is that? Well, 78% of us find the news on the virus alarming and stressful. And that's something that communication specialists need to take into account. But we also find it repetitive and boring, as mentioned by 49%, and 48% find the information confusing. I think Jackie and Mercy have both alluded to, how do we crystallize and make the information more clear? Then there are those who find the information complicated. And right now, the exaggeration of the pandemic is not as high as we saw at the onset. So I think that generally gives you, a feel of the psychosocial, state of Kenyans and the economic state of Kenyans with regards to the pandemic, and the questions then on how to communicate effectively for, the positive effect that, as Jackie was saying, does not initiate fear. I'm hoping, Derek, that we'll be able to play the ads very quickly for the panelists to see. If it is not possible, then we can zoom into the next presentation. But it would be good for us to see the array of ads. What we did is, I've shown you quantitative data, but we also did a qualitative study where we picked different advertisements from different stakeholders, government, private sector, and companies that are listed in the stock exchange like Safaricom. And we basically asked respondents what they felt about those adverts and whether those adverts actually made sense to them or not. Derek tells me he's ready, and so he will now play the first advert and then the subsequent adverts in quick succession so that you get an idea of what it is I will show in the last slide that I have. Derek, over to you.
Fight the spread of coronavirus, learn Lifebuoy's hand washing habits. Wash hands with soap or use an alcohol-based hand sanitizer. Together, let's help fight the spread of coronavirus in Kenya.
You know, the best way to stop any viruses from spreading is by washing your hands. But did you know by using any soap, you could get rid of all disease-causing germs? Germs can easily stick to your hands, and when you use water only, it rushes right over the virus. But when you use soap, the fat layers that attach the virus to the hands get pulled out, and the soap demolishes these viruses. It takes at least 20 seconds for this effect to take place. Experts also recommend hand sanitizers with at least 60% alcohol. This message is brought to you in the public interest by Imperial Leather.
Since late last year, the coronavirus COVID-19 has emerged as a serious infection that has gone global. This is an infection that has gone global and no one has been spared. The government, through the Ministry of Health, has put in measures to keep Kenyans safe against COVID-19, to keep Kenyans safe around the world, which is currently rampant around the world, with new confirmed infections and sanitization and screening of visitors and across every entry border post country and across is very vital in preventing the spread of the disease in the country.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive.
Since late last year, the coronavirus COVID-19 has emerged as a serious healthcare threat. This is an infection that has gone global and no one has been spared. The government, through the Ministry of Health, has put in measures to keep Kenyans safe against COVID-19, which is currently rampant around the world, with new confirmed infections and death cases daily. Such sanitization and screening of visitors at this border post and across every entry point in the country is very vital in preventing the spread of the disease in the country.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
It is scary that a single cough here can lead to an outbreak of epic proportions. In order to prevent that, the government has instituted measures to keep Kenyans safe.
The facility has all the equipments you need, from handling a basic patient up to ICU setting.
However, you also have a role to play in preventing spread of infections.
Members of the public are encouraged to remain vigilant as the risk is still high. Let's maintain basic hand and respiratory hygiene.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
We have faced many severe challenges as a nation, and we have always found a way to rise above them. COVID-19 is no different, and we'll overcome the pandemic. Stop coronavirus. Follow all directives from the Ministry of Health. Wash your hands properly.
Right, so those then are the ads that we looked at. And what we found is there was no ad that fully resonated with the general public. There was something they found wrong with every single one of those ads. There were things they liked about the ads with regards to whether they resonated with them, so whether those ads engaged them, whether the ads were credible and believable, whether the ads were relevant and appealing, persuasive, and easy to comprehend and unique. None of the ads scored a full score on a scale of 1 to 5 on every one of the aspects. In fact, the government ad was found to be the most engaging. It was second in credibility and relevance, but then after that, it dropped off. The Safaricom ad was not perceived to be as credible and believable and engaging, but it was the most relevant in terms of appeal, and it was the most persuasive. And we then saw that the Dettol ad was the most easy to comprehend and the most unique, but then dropped off from the rest. The Imperial Leather ad was the most credible and believable. And then the Lifebuoy ad was also seen to be easy to use. But they were all, those things that made each one of them require a tweak that would necessitate us to actually ask ourselves, how do we come up with some form of communication that can engage people and motivate people in a positive manner? Thank you, Walter. Back to you.
Okay, thank you, Angela. Right, my next panelist is a journalist of no mean repute. Churchill Otieno is a leading journalist with 19 years experience in digital media, in managing editor, and is a managing editor, for digital at Nation Media Group, and is the current president of the Kenya Editors Guild. He specializes in communication and digital transformation, and is also a visiting lecturer at the Aga Khan University Graduate School of Media and Communications.
Good afternoon. I hope I'm loud and clear.
Yes, we can hear you, Churchill.
Thank you. You have my slide?
Yes.
Next slide. I joined this meeting today as the president of the Kenya Editors Guild. The Editors Guild is a professional association of senior editors in Kenya, and our mandate really is to focus on four main pillars. The first one is to defend media freedom and its independence in the country. The second one, and one that is very close to our hearts, is to promote quality and ethical journalism. And that grows from Chapter 36, 35 of the Constitution. Of the Constitution that makes to provide a forum where issues that face performance of journalism can be debated. And I believe this forum that we're having today is one of such. And the last one is networking. Next slide. So today, looking at COVID, my role really today is to reflect on the performance of journalism as we go covering the COVID story, which is arguably the most important story of our generation, if you may. This pandemic has brought fairly significant pressure on the performance of the journalist's role of being a watchdog in society. Watchdog basically means that our core duty is to hold those in positions of power to account. And to be able to do that, there are several elements that need to fall in place. And many of these elements have come under severe pressure.
Excuse me, Churchill.
Let's look at the first. Yes.
Can they adjust your mic? We're having some difficulty hearing you.
Okay.
Is this any better?
Yeah, much better, Churchill.
Much better?
Yeah.
So I'm looking at, I've chosen to look at the ability of our journalism to deliver the COVID story from three dimensions. The first dimension is the question of our media houses. As it were, the way journalism in Kenya is delivered is through commercially oriented media houses in the name of Nation Media Group, in the name of Standard Media Group, in the name of Royal Media. So to issues come out strongly for us when you look at the media house. One, because these media houses are essentially commercial enterprises. When their revenues fall or come down, that pressure automatically goes into their ability to deliver investigative stories. Remember that we live in a time. CS for Health has just finished his address to the nation, delivering fairly directly to the audience the message he has today on the pandemic. So the duty of the media really is to find the hidden story, to find the story that is difficult to confirm and difficult to tell. And that's what we are calling investigative stories. It follows that these stories also tend to be the more expensive to create, the more expensive to do, because you need fairly well-experienced, highly trained journalists to do them, who tend to be also expensive. And also you need a lot of time to find and verify the information, process it, and bring it to your audience. In a situation where revenues are reduced, the budgets for innovative storytelling also come down. Because it's just natural that investors in the private sector ordinarily wouldn't usually want to go at a loss. We could debate that, but that's just the nature of that life. The second pillar is the professional in that space, the journalist, him or herself. And three things come into play there. One, and I think it's fairly now public, that up to 400 journalists have lost their jobs this year alone. The entirety of the rest of them have had to live with pay cuts from as high as 50%, and the least is 10%. The total impact of that is that you are working with a lot that is not as incentivized as it used to be. Number two, because of social distancing and work from home arrangements and the true nature of the disease that we're dealing with, work for the journalists has become a lot more difficult. Ideally, for just an example, ideally we should be able to visit hospitals to be able to accurately tell the country the story of how medics and patients are having to cope with the reality of this pandemic. To be able to do that, journalists will need PPAs, as an example, be it the reporter, be it the photographer. And many times, not every single journalist is able to get this. Number two, work, because of these work from home arrangements, work has become a lot more stressful. So just as a human being, you find that it becomes more challenging. Usually the newsroom is a very stressful environment, as many who've been there would attest. These arrangements have further complicated that space. So the total sum of that is that the journalist finds himself and herself being a lot more stressed and a lot more fatigued. That has impact on performance on an ongoing basis. But those two factors has a critical effect in terms of delivery of a story that makes sense to the audience, because the newsrooms are getting thinner and thinner, and therefore less able to carry that heavy burden. Yet, I think it's a global reality that the world has never seen something like this. Yeah? So it's the time that we needed journalists to be at their tip-top, to be at their best mentally and even physically. So that reality is something that as leaders in the industry, we are having to deal with, and we are having to look for ways to cope so as to enable us keep telling this story. And remember, the fact that the story is fairly stretched out. I mean, the corona story started in January. We are now almost into August, and it's still here with us. Arguably, it will continue being with us towards the end of the year. So it is a long, drawn-out story. It requires that we bring fairly brilliant and imaginative ways, that we change the way we tell this story every single every so often, and that in itself requires ongoing investment. The third pillar is the audience. For whom are we telling these stories? One, it is a fact of science that when a story becomes repetitive, and I think the data that Angela shared with us earlier brings that point out very, very clearly, that people are stressed, they find our stories negative and boring. But when stories become repetitive, many, many chunks of the audience begin to sort of shut out that messaging. And they become fatigued mentally and essentially grow numb. Yet, the more this virus spreads in our society, the more we need a majority in our society to pay attention and to learn how to cope, to learn how to keep themselves safe. So we find that these three interacting elements create a dysfunction in the overall impact, the overall performance of media. It is a concern to us as journalists and as editors, but we think it must be a concern for the larger public indeed, because that lack of an effective media would mean that in a situation like we are in today, for example, where there's lots and lots of disinformation, when the media is shrinking, the public will get to a situation where we don't have sufficient trusted media to deliver the critical message that the health experts, for example, would want us to get so as to be able to cope from a public health dimension. Next slide. So in terms of recommendations, what are we saying? Number one, we are saying that Kenyans, through the Constitution, have asked for the media to base its actions, to base its performance on a public interest framework. What this basically means is that the most important duty that the media has is to deliver to the public information that they can use to make their lives better, but also information that they can use to hold those in positions of privilege, those in public offices, to account in terms of service delivery to that very same public. And we are saying that legal and administrative measures needs to be taken to protect the independent media to be able to continue to play that role if our democracy can continue to thrive. Number two, radio continues to, is by far the most important media when you talk about reach. And in many of our counties, in many of our communities, when you move away from the urban areas, a lot more people rely on radio more than anything else. This media also happens to be the weakest and the most vulnerable when it comes to impacts of COVID on media performance. We are saying that as a nation, we need to find ways to strengthen community media so as to ensure that the entire ecosystem of delivering reliable and dependable COVID messaging is available for those in the Ministry of Health, those in government, but also for the general national debate around coping with this disease. Number two, and this speaks more to us in the media space, is that in spite of the challenges that we have, we need to find ways to go beyond the numbers that the ministry is giving us every day. We need to find ways to find the faces, to find the people, and to tell the stories of how these people are coping. And linked to that is we find, and I think this is now fairly public knowledge, and some of the speakers have mentioned this earlier, that pockets of the public are ignoring public health recommendations on how to stay safe. But the question we must ask ourselves is why? Some of it I think is fairly obvious. This disease has affected our livelihoods in every single way. But for many people, they're confronted with the real dilemma. Do I stay safe from corona and become more vulnerable to something else out of my socio-economic circumstances? Or do I, play lucky, play a Russian roulette game, if you like, and go chase my cheese and hope that I don't catch the virus anyway? I think that dimension of the story needs to be told, and many editors are beginning to ask themselves how best to get it and to tell it effectively. Number three, our recommendation speaks to the journalist himself or herself. But for us to get the dependable investigative story, the individual flying that trade, the individual professional, needs to be protected. And this protection and support needs to come from a psychosocial and digital dimension. Psychosocial, because I don't think the stress will go away. So we need ways to get support for those journalists. But the second thing is that as we work more from home, digital connections becomes the reality, becomes the norm. And that comes with its own threats, the most important of which many journalists would like to protect their sources, because if I'm an impactful and effective investigative journalist, those for whom I've been investigating stories against will be keen to get their hands into my information. And we're seeing lots and lots of threats coming from that dimension, but we're also seeing a lot of attacks against journalists, especially on social media. So that protection is key, and the more journalists we protect and support in that manner, the more we encourage good journalism. Then there's a question of economic and physical protection. I think it goes straight that where the economic infrastructure, the economic ecosystem that supports our journalism is threatened, it's not just a question that worries journalists, but it's also a question that worries those who depend on the products of journalism. And I think as a nation, we need to have a conversation around that. And thank you, and I'm happy to take any questions.
Okay, thank you, Churchill. As I mentioned, the Q&A will be at the end of the session. So any questions for Churchill, kindly hold them until the end. Our next panelist is Mr. Harry Mwagona, a brand development and communication specialist. Harry is a brand and communication specialist with 18 years professional experience in development and coordination of brand and marketing communication strategies, business development, production, development, and management. He has a keen interest in sustainable development, especially the thematic areas of shared value and collective impact. Welcome, Harry.
Asante sana. I just wanted to know, will I use my own, can I share from my end?
Yes, you can.
Okay. Yeah, very interesting conversation so far. And I've been keenly listening, and there are various things which have been coming up. But I just want to take you back to something very, very important very interesting that was mentioned. People are talking about, there are very, very many issues currently, as Angela talked about, going on in Kenyans' minds. All of them are thinking about, how do I protect my lives? How do I protect my livelihoods? And also, how do I protect my future? But in all these things, the government needs to have a conversation. It needs to communicate. The government needs to communicate. And why does the government need to communicate? The government needs to communicate basically to inform, to advocate and persuade the citizens, and also to engage. But when you look at the communication, and based on the research, people are viewing the communication as boring, stressful, confusing, repetitive, alarming. So in all this, what do we need to do? Then again, just to throw it out there, the adverts, the various, those various feedback about the adverts. Some were saying they were They're not engaging. In terms of believability, it was next to nil. Credibility was low. Some were not persuasive, and in terms of comprehension, they're not very easy to comprehend. But just looking at the current situation, and these are musings from someone who has been in Nairobi, and also currently I'm in the Coast region. People are parking bars and restaurants with no compliance to the protocols. I think with the announcement by the president yesterday, I think this will come to pass. There's been a myth going around suggesting that COVID is but a way of the government getting money from the donors. Mystery to me how that makes sense at all. People are avoiding testing due to fear of being quarantined in the government facilities. Political rallies are back in vogue with no observation of the laid out protocols. The other day I was in Gikomba and saw numerous hand washing stations, but very few masks. Don't ask me what I was doing in Gikomba. A little kid in our compound told me the other day that they are immune. I don't know where that kid had that from, either the mother or the father, or on I don't know where the kid gets that news from. Our household finally saw this thing is real after Papa Sharandula died. Now, there have been various conversations, and I'm even looking at the various chats going on about the communication. And as grave. I don't know, you can hear me?
Sorry, Henry, we lost you for a minute.
Yeah, but I'm back. Can you hear me now? Sorry, power has gone out here.
Yeah, we can hear you.
Yeah. So the question we need to ask is, what are the specific needs that the communication sought to solve when you're looking at the adverts that have been run and also the various communications that have been running? Madam Mogeni was talking about the communication at the county level, and Kas Mwangangi was also talking about the communication at the national level. Then the other fact of the matter is the pandemic has permeated 45 counties now. And that means that this is now within all our communities. The question we need to ask ourselves again is, how does that impact on the communication which we are driving? Over and above the community leaders, the chiefs and the sub-chiefs and the community health workers, and also the pronouncements and updates from Afia House, and also these adverts which are running, what more needs to be done in view of this new development that the community now is facing this thing and they're actually living it. And then when we look at it and in terms of the communication objectives, have this been met? And then the question is, who are we targeting with the communication? Then the other question which we need to ask ourselves is, are the communication objectives and the messaging and the vehicle we were pushing at that time, 3 months ago, still relevant now? Because in March, and here we're looking at July, that's about 4 months down the line, there's been very, very many dynamics. The numbers have increased. The various protocols have been brought to the table. So there's been cessation of movement. And basically what we're trying to say is, what we sought to communicate at the beginning was supposed to address specific actions. Are those actions relevant now, or have new dynamics come into play which needs a retweak of the communication? I don't know, you can hear me?
Yes, we can hear you.
Yeah, now looking at the current communication, again, I'm asking, who is the target audience? And the other question which we need to ask ourselves, when you look at all the ads, they're telling people you guys need to wash your hands, social distancing, wearing masks, and there's this crazy pandemic that's coming. Basically, to me, awareness is no longer an issue to warrant the communication to focus on that. And when you look at the ads, in my view, they're just relaying information. There's very little emotion in them, very little shareability. In fact, I dare say it's forgettable stuff. And I'm seeing the various people in this panel who are from creative agencies, and I think they'll understand when I'm saying it's forgettable stuff. Communication should actually make me as an informant, as an information recipient, feel and get me invested in it. And to me, when you look at the current communication, it's not creating any emotional connection or resonating or making me spur to action. So I think maybe the thing is, maybe we need to move away from the functional ads and try to see basically what is not working, and I think research here comes into play. I think Infotrak, need to interrogate further why, because there are very, very many informations, and there's a lot of information that is going out there. And I think Kasmuagangi was also talking about that. I think the other day she was lamenting on TV that people do not listen. So what is not happening? Someone in a village in Kisii cannot relate, and they probably don't even believe that COVID could impact them. When you look at the Safaricom ad, for example, or the Lifeboy ads where they're telling me to wash my hands. And I think all the other panels who have talked earlier, they have alluded to this issue that there's communication fatigue. So the big question is this: what do we need to tweak the communication to kickstart and drive the relevance of communication, looking at the various audiences across the 47 counties, and also the various stages of the people who have been affected by this disease. And to me, some quick points to ponder. Who is our target audience? When this communication is being crafted, is it a blanket focus? And if it's a blanket focus, is that really working? And at this point in time, we are in July heading towards August. What is the current need the communication should be solving? And again, to ask what exactly is not working, because Kenyans, to use the slang, Kenyans are feeling nothing. Then the other issue is, how are the awareness levels of the various phases of the pandemic? And what do we seek to tell them? Someone earlier on was talking about, for example, if I'm in my house and I feel signs of the COVID, what do I need to do?
Excuse me, Harry, one more minute.
Yeah. Okay. So basically, the ones who haven't tested and are healthy, walking around in Kilifi, what should we be telling them? Those that are symptomatic, what should we be telling them? And then the other quick question we need to ask ourselves is, what are the vehicles we're using to get to the masses? And key is, what is the single most important action that would be most effective, and how does it impact normal human behavior? Should everyone rally around washing of hands? Should everyone rally around wearing of masks, social distances? Then how can we face our communication, and how can we rally the private sector and other actors around that particular singular most important action? To me, the way forward is this: we need to look outside there and see what some of the best public service announcement work ever done. There's one called Dumb Ways to Die, very emotional, relatable, and highly memorable. And just a thought, I'm not a creative person. What if we got Papa Shirandula to pass on a message from the grave? I'm sure if we went through his crazy footage of his glory days, we could get clips of where he says, nakuomba hii kitu ni mbaya, inaweza maliza mtu kama mimi na pia wewe. Tafadhali naomba ujilinde na ujichunge sana, kaa chonjo. I mean, how can we basically have a blanket campaign that will basically rally everyone around it? My call to action, The president yesterday mentioned it again. This is a war cry. We are at war, and it calls for all of us to defend ourselves and our community. To most Kenyans, COVID is a faraway concept. You're hearing about it, but it has not touched you or those close to you. Communication needs to bring it closer. Make it emotive, make people understand what it means not to have time and not to have air. We need to take the communication to the counties and to the community. So my call is, we need to get the brands involved. We need to have the Safaricom's Life Boys of this world to move away from driving the personal brands and come up with one campaign. I think those who are as old as me will remember the We Are the World campaign and how effective it was, where it brought the whole world together to sort out the hunger issue in Ethiopia. The Kenya COVID-19 Fund Board has done a commendable job. Their focus has been basically on PPEs and other interventions. My view is they need to take the lead in driving this by creating an idea with a call that will rally all Kenyans around it. Can we shift basically the battlefront to communication? Private sector has access to the most brilliant creative minds in the world through their ad agencies. I'm about done. Huh? So the challenge is this: can Kasmwangangi take all, basically using Kenya COVID-19 Fund Board, bring in all the actors who are specialists in basically in developing creative ideas, and also bring in behavioral change communication specialists like John Hopkins, who are in this session, to basically come up with something that will basically be able to rally people and develop that communication idea, and tell Kenyans that we are at war and we need to move and sing from the same script. So my call is, Ministry of Health should convene these actors, basically private sector, BCC specialists, and we move the war to the communication battlefront. Asanteni.
Thank you, Harry. Our next panelist, Dr. Wilfred Marube, the president of the Public Relations Society of Kenya. Dr. Marube has a wealth of experience in public relations and communications management as a practitioner, facilitator, trainer, and scholar. He has been involved in numerous projects centered on development of strategic plans, strategies, audits, and management communication and training programs. He's currently the Chief Executive Officer of the Kenyan Export Promotion and Branding Agency. Karibu Daktari.
Okay, thank you. So good afternoon, participants and delegates. Thank you to the Infotrak Research Group for having this particular panel discussion, which looks at an interesting topic on communication during pandemics and a movement from chaos to progress. And I think from the title of this particular discussion, it highlights the challenges and the dilemma which is facing communicators and health professionals. My presentation is going to be oral. I don't have a PowerPoint presentation, but it will be along the same line as Harry. I believe Harry has basically taken everything of my presentation or my mouth, but I'm going to reflect and make my oral presentation on three particular facets. The first question I'm going to pose as a way of reflection is, why is communication on pandemics such a complex affair? That would be one area that I would want to reflect upon, on why communication on pandemics is such a complex. It's a very broad and rhetoric question, but which points out to the unprecedented approach that we are facing as communicators. Then the second aspect of my presentation is going to be a reflection on Kenya's performance on COVID-19 communication. And by use of the word Kenya, it's all inclusive of government and other actors within the communication space. And then finally, also in line with Harry's presentation, will be what are my thoughts and the suggested further action on COVID communication in Kenya. And in today's presentation, I speak as the president for the Public Relations Society of Kenya. This is a professional body of over 3,000 communication professionals in Kenya, in private sector, in government, and in the academia. So I represent the views and the perspectives of the public relations industry. So on the first part, I would want to say that communication on pandemics is complex because it addresses three broad communication approaches. That is, there is the health communication part, which is in line with the behavior change communication. And then the other part is that we are dealing with a crisis. And also we are dealing with organizations whose reputations are at stake because of this pandemic. And finally, we are dealing with the power of media. So the aspect of media relations and media management becomes very key in this aspect. So that from a broader communication point of view, we're talking about health issues. COVID-19 affects people. It affects the health of people. So health issues become very key in terms of COVID. But apart from that, and has been highlighted by the other panelists, it goes beyond health. And I think the survey which has been carried out by Infotrak reflects that by indicating the socio-economic, especially the economic effects. So COVID-19 has morphed from being a health issue to being an economic issue. People's livelihoods have been lost. People's jobs are no longer tenable. Businesses are closing. So this affects the cash flow and people's ability to meet their basic needs. So that also becomes an issue that needs to be addressed from a communication point of view. And then finally, it talks about social relationships. As human beings, we are social beings. We like interacting with each other. We like shaking hands. We like hugging. We like talking and whispering to each other. So all this has been affected by COVID-19 as a pandemic. So as we talk about that, then broadly we would say that we are dealing with emotional issues that people are facing out of the social disruption of their relationships and on their form of interaction. We're also talking that people's health is at risk. So the aspect of safety from a health point of view is very important. But again, we're talking about emotions. People want hope. People want to know that something good is happening. Even as right now we are saying it's all gloom, but there must be something nice happening, something positive happening. So all this makes communication on pandemics, especially COVID-19, a complex aspect because a purely health communication approach will not be able to deal with the socioeconomic and also the media management aspects. Our crisis management approach on its own will not work. A media relations and management approach on its own will not work. So from that high point of view, then we're talking that this particular pandemic brings about, and I think this has been reflected from the presentation by Harry, on a whole new approach which is integrated, what I would call an integrated communications approach, whereby it will focus on health issues. It needs to focus on crisis issues, that is dealing with challenges and other problems which are beyond health facing the citizens, the residents, and other people within this ecosystem. And finally, dealing with these special constituents, which panelist Churchill has clearly articulated, the power of media. So in my view, unless we combine health communication, crisis reputation, or what we could call corporate communications, and media management, then it's going to be pretty difficult. And so far it's been, as already you can reflect, you can see that there have been challenges because we have tended to lean towards one part of communication, that is the health communication bit. And we have forgotten the crisis bit or the reputation communication bit, because it's about the image of institutions. It's about the image of the government of Kenya. It's about the image of the Ministry of Health, because part of this communication should be addressing that. And perhaps when we move to the second part of my reflection, we'll be able to ask ourselves, how are they meant to do that? But at the end of the day, communication ought to be purposeful. We are just not communicating for the sake of communication. Though we are aware that you are supposed to deal with health issues, the health of the citizens of Kenya or the residents of Kenya, you are meant to deal with giving people hope. That's part of the socio-economic, the social part of it and the socio-economic. But communication broadly in this particular pandemic ought to achieve three objectives in my view. The first one, it needs to lead to change of behavior by the Kenyans. And this behavior is just not one behavior. It's a behavior that gets modified. So communication must move and change alongside the behavior change journey. So that would be one of the objectives, change the behavior of Kenyans. So that every day, anytime we send out communication or we're reflecting about it, we should ask ourselves, which behavior do we want to change? Or which new behavior do we want to instill? The second part again is that just as the Ministry of Health has kept on saying, and the President, that is the aspect about, this is a war. We are fighting an invisible enemy. But apart from that, we even talk about the aspect of, this is individual responsibility, be responsible. Follow the three key interventions which have been outlined by the ministry. But then that one calls for support, because in enforcement and forcefully using other means may not give us the desired results. So it requires the support and satisfaction of the citizens and other stakeholders, which becomes the second objective of any communication around this area. So to what extent is the communication geared towards mobilizing the support and the goodwill of the citizens and the residents of Kenya, so that we're able to achieve this objective? So that becomes the second objective for this broad communication on COVID-19 pandemics. But finally, as public relations specialists always say, in the midst of a pandemic or a crisis, it's an opportunity for you to profile and boost your image and reputation. So the third aspect or objective of communication in such then would be, it's about boosting the image and positive reputation of all the actors involved, be they state actors like governments, ministries, state departments, or even private sector. So to what extent has that been done? So this makes this particular communication on this pandemic complex, because as you can see, the objectives are very broad. They go beyond a public health issue. They move into, as we said, reputational issues and also media relations issue. So that is the first part on my reflection. Then the second part is, and I know it has been explained, I may not want to belabor it. We've seen from the presentations of Dr. Mercy that on what government has done on its communication. So the question is, how has been government's performance on COVID-19 communication, sorry. I would want to look at it from various aspects, but from a high level, I would want to ask myself this question. To what extent has communication by state actors and non-state actors led to behavior change communication, to behavior change? To that aspect, I feel we've done a good job, and the ministry and government must be commended. It has become almost automatic, at least in the urban centers, to wear a mask. It has become almost automatic to sanitize, has become normal, and to wash your hands, and to social distance, especially among strangers. So to that effect, in terms of creating awareness on the need to change behavior, and partly adoption of the change of behavior has done very well, in my view. So to that extent, on that reflection, then I would say there has been commendable effort by all the actors in this pandemic. Then the second question is, to what extent has the communication on COVID-19 been able to mobilize stakeholder and citizen support and goodwill? That I could say we've made initial efforts, But because of the mistrust, because citizens ordinarily mistrust public institutions, but because of the mistrust, there could be work that can be done more on mobilizing citizen stakeholders as stakeholders. Let them be part of the process. We are aware there's Nyumba Kumi, which is working, yes. But Nyumba Kumi just focuses on part of the market segment, part of the citizenry. There are people who do not operate under Nyumba Kumi, or they are not aware of its existence, but they are willing to support. So I think that's an area probably that could be worked on in terms of mobilizing citizen support, though we know that something is being done. And then as an opportunity to demonstrate goodwill or positive aspects on what state actors, that means the government and private sector, are doing in terms of supporting this. We've already seen, actually, my view is that the non-state actors are taking more credit from the investment of what government has done. And I think this is something that probably, there's a lot which has been done, but I think because we are focused too much on communicating on health issues, we are basically not saying what you've done. And already from the plans, you can see the government has an elaborate system. Ministry of Health has an elaborate system. It has done quite a lot. There's a stimulus package which was announced by His Excellency the President, and many other things. So that is an area that could also be galvanized to give hope and also as an opportunity to profile state actors in a positive way. The other thing, as we want to reflect on performance on COVID, we would want to ask ourselves, is there a communication strategy involved? And then obviously you can see there's a strategy involved. On whether it is effective or not, I think that's something that we could probably give it a challenge that needs to be reviewed according to the changing times. And then the other aspects in terms of reflection on government is that what channels as state actors and other actors used in pushing their messages during this campaign. And as highlighted by other presenters, we seem to have not utilized the full power of radio and other community engagements. Television adverts are good for awareness creation, but beyond, in terms of moving people into action, changing their behavior, probably we need to think about many more channels of communication. And I think that is one of the reflections we would talk about. There's need to think about more channels of communication. And when you look at structure seems to be there. Already you can see there has been constant daily briefing for the last 5 months, which has actually been very important in terms of creating structure. At least people know that we expect some update today. And I think that is important. But which takes me to the probably the third part in terms of this presentation. And that is, what are the suggestions towards improvement of COVID-19 communication, especially suggestions bearing in mind, and I want to premise my argument on this, that this communication ought to be integrated. So my first suggestion would be, we need a robust approach towards communication, which combines health communication, crisis and reputational communication together with media relations management, so that when all these three are combined, we are able to address both health issues, the socioeconomic issues emanating out of this particular pandemic. The other aspect that in terms of my suggestion would be, any effective communication must be research-based. The Ministry of Health is making its decisions on some of the interventions based on research and on feedback coming from the ground. The question we'll be asking is, to what extent has this also informed the communication? Because it appears that some of the communication is not based on research. It is basically something that is being pushed out without understanding who are the target audiences and what are the main concerns for the moment. And to this, I would want to add that we need more evidence or more research-based communication so that we're able to address the emerging issues out of this particular pandemic. We must be aware that in communication, ordinarily there are about maybe five steps which any communication program goes through. There is the awareness part. Then there is the comprehension part. And then we're talking about change of attitudes and moving people towards action. We have done very well.
Excuse me, Dr. One more minute.
Yes, but we need now to move the audience and the residents above the staircase. So now they understand the messages better. they are able to change their attitudes, including stigma, and then move into action. And that one requires a bit of research. So my urge would be, let's focus on the next phase of communication on research. And then finally, we'd want to urge that the next phase of communication should be more interpersonal and much more community-based. So let's move away from a very centralized high-level communication to more community engagement, to more face-to-face interactions, either on radio or on TV. So broadly speaking, my parting shots, we need an integrated approach towards handling the pandemic that is on COVID-19. Thank you, moderator. I submit and I stop.
Thank you, sir. Our next panelist is Robert Ainsley, Senior Program Officer, Johns Hopkins Center for Communication Programs in Indonesia. Robert has over 25 years experience working in communication and development. He has worked in diverse places such as Mozambique, Haiti, Nicaragua, Brazil, Guatemala, Cambodia, and Tanzania. And the work he's been involved in has been influential in the development of an adoption of national communication strategies in malaria, water, sanitation, hygiene, as well as reproductive health. Welcome, Robert.
Hello, thank you, everybody. Good afternoon. I'm very glad to be here with you all today. Thank you very much for Infotrak for the invitation. Today, I'm going to talk about risk communication and community engagement strategy here that's being used in Indonesia with the Ministry of Health. I am with Johns Hopkins Center for Communication Programs and implementing the Breakthrough Action Project, which is funded and supported by USAID. So a little background here in Indonesia. Just yesterday, we broke 100,000 mark of positive cases. We have about 4,800 deaths so far. This is probably underreported by 2 or 3 times from other information that's come out. As in most of the world, a number of cities and districts went into lockdown in April-May time period. And then those restrictions started easing in the beginning of June. So we're in a transition period from the lockdown to what's going to happen next. We're totally not sure what that's going to be. However, the cases are still increasing here in Indonesia. There was, in the beginning, around March, a national task force for COVID-19 response, and that's the overall national body for responding to COVID. It's made up of a number of different ministries and other groups for that overall task force. And then we also have what we call the Risk Communication and Community Engagement Task Force, which was mentioned earlier, which is made up of government agencies, NGOs, and private sectors participants. And we meet weekly to discuss what's happening, have different speakers, resource people, but also understanding where we are in the communication around COVID-19 in Indonesia and what the messaging is and how we can change that and adapt it as we need to. So when we're looking at risk communication, we're looking at really getting out the critical information in a very timely manner. People need to get the information to ensure they can make the right decision to protect themselves and their loved ones. So what's the information they need and how they get that information, and ensuring that we have the correct information so they can make the decisions they need to make. In COVID, we're looking at the need to reduce risk of getting COVID, what to do if you're positive, and where to find the information that you need. And these are the critical parts when we're looking at risk communication, ensuring that people know how to reduce the chances of getting it, but also if they suspect they have it, what should they do and where should they go? And also where can they get the information they need, whether that's at a health facility, whether that's at a community group. We have community level task forces set up, going down to the smallest unit here in Indonesia. So ensuring that people know where the information is and they have it at their fingertips. So when we're looking at effective risk communication and community engagement, we're looking at it, it's built on trust. And I think we've heard a number of speakers talk about responding to community concerns And is participatory? Are there feedback loops so it's not only top down but bottom up? Are people able to comment, to ask questions and become part of the process? There are a lot of two-way communication channels you can use, whether those are hotlines, they could be interactive voice recordings, community meetings that information gets put up, and also at looking at social media. And we do here social media listening and monitoring, so ensure what's happening all over Indonesian social media. We're understanding what people are talking about and what's raising, whether it's hoaxes, whether it's people are angry at the government or angry at other people, understanding what's happening in that space and then trying to respond to that in press conferences, in communication going out, whether that's on other social media channels or what have you. It's also important that it's coordinated, it meets holistic needs of the community, it leverages lessons learned, and also local structures and capacity. So is it using what's already established in the best way possible? Not looking for new ways to do it, but what's already there and what's the easiest way to get down to the community level? Because we know we can do national campaigns, we can do national social media campaigns, but is it getting down to the lowest community level and that people are understanding what's going on? It's also important that when we talk about communicating information, a lot of governments, and here is ministries developed guidelines, COVID-19 guidelines, developed it, sent it out and said, okay, we're done. We have the guideline, everybody should understand it. But it's really the responsibility of the communicators to really interpret what those guidelines are, because they're very hard to understand, and break it down into very easy information. So when we're talking about risk communication and getting the information out, it's not just guidelines in very hard ways to understand, but taking those guidelines and breaking them down. So when we look at this at a social behavior change lens, we look at a different, we look at it at different levels. And starting at the individual level, right there at the bottom, is looking at the knowledge, skills, the beliefs. What does the person need to know? What does he have to have, she have, so that the individual behavior change can happen? And we know that around the individual are their family and peer networks. And these are the people that make up the individual circles, the circle: spouses, children, in-laws, neighbors, religious leaders, your support, your social support. And these are the ones that are going to help influence what the social norm is around the behaviors you're looking at. Going from there, we have the community. We know the community has leadership, it has the community information, and these are the structures around the individual and the family, the leadership, the collective efficacy, and also including in the delivery of services. So this could be your health services, this could be your schools, but also where the services are delivered as well as commodities. And then within that, you have the social structure. And these are what we call the enabling environment. So what's in place in the enabling environment around policies, resources, media and technology, media advocacy, and the resources necessary to ensure that the structures are in place that help get the information, the communication around those different behaviors that you want to change down through the community, to the family and peer networks, and to the individual. So if we want to look at lasting and sustaining change, we need to look at each of those levels and what our activities will be doing. So when we're looking at perception of risk, Paul Slavic posited that we're less concerned about health risks that are voluntary, familiar, controllable, controlled by self, fair, endemic, not fatal. So what we know really doesn't bother us. We can deal with that risk a little easier, and sometimes we don't even pay attention to the risk. We can look at malaria. It's been around for a long time. People sometimes are used to it within their life cycle, and they forget about the risks around malaria. However, we are more concerned about health risks that are involuntary, unfamiliar, uncontrollable, grouped by time and location, and fatal. So we're also looking at, this fits pretty well with COVID right now. And we want people to have that risk and the perceived risk, because if they don't have that risk, they're not able to on that risk, do the things they need to do and change the behaviors to reduce their risk in getting the virus. And so when we talked about earlier about communication or behavior change in communication needs to be strategic, we look at different models. And one of the models we look at, especially we're dealing with here, is called the extended parallel process model. And we look at where we see the perceived threat in this area here. So is there a perceived threat? Are you susceptible to it? Is it severe? If you don't have a perceived threat, you disregard the message and no one's going to pay attention to it. However, if you do have a perceived threat, then you start thinking, okay, I need to really work on how do I deal with this and contain this risk. But you also have to have perceived efficacy. So the self-efficacy is, what can I do about it? Do I have what it takes to actually reduce the risk of getting this virus? So if you don't have self-efficacy and you don't know what to do, you have fear. You don't know what to do and you kind of give up, and you'll also reject the message. So what you need to have is the perceived threat and the risk that you believe is there, but also you have the information you need. You have the self-efficacy to do what you need to do to reduce that risk. And so when we look at the messages above, we need to make sure they're balanced and we understand that it's based in research and what we know, so that we can ensure that people know that there is a risk involved, but also here's how you deal with that risk. So here in Indonesia, we looked at the three main key behaviors, and this is around the health and reducing, as physical distancing. And part of that physical distancing is avoiding crowds, avoiding markets, going indoors, etc. Wearing masks, obviously, and hand washing. What's the correct time to hand wash, sanitizer, soap, etc. So those are the three main messages. You have the messages and you have the behaviors we're looking at, but you have to explain, people have to know why you have to do these behaviors. So what's the importance? So we look at how COVID is spread. We look at it as a droplet which the virus is in the droplet. It can be spread by aerosol and in the droplet, and it can be done in closed spaces, on objects, on hands, or sneezing. Those are the main ways that it then gets into your body through eyes, mouth, or nose. And we know that the three main behaviors would prevent that from happening, so reducing your risk. But it's important when we're looking at this to be able to say that information in our messaging in a way that's comprehensible and that people would understand, but also to our stakeholders, to our medical personnel, and to our volunteers when they're in the community, so they can explain why we have to do these different behaviors. So this is our strategy here in Indonesia, looking at what our goals are, is to have fast, accurate information so that it can change and is responsive, encourage changes in behaviors, and also responsive to COVID information. As we know, when this started back in January to now, we've changed messaging around masks, around how it can spread. We didn't know about aerosols until about a month and a half ago when we started talking about it. So we have to be able to change as we go. And looking at our strategies, we're using mass communication, community participation, and a number of our panelists has discussed, it's really important to make that connection at the community level. Capacity building for health facility staff and volunteers so that they're capable to manage the communication messaging, but also to help at case management within the facilities, but also in the community. And then stakeholder involvement. Who are your religious leaders, your key opinion leaders, community leaders that can help move that message forward and really engage their audiences. And religious leaders are very important in this. Here in Indonesia, where 90% of the population is Muslim, we're looking at a population around 260 million here. So early on, religious leaders were engaged and started talking about the need for the behaviors, but also around closing down houses of worship, mosques, and home. And we're looking at also for what we talk, well, in a second, and our three main messages, and then our communication channels. So looking at TV, radio, social media, which has taken off, but it doesn't always get down to the lowest level. So be very cautious when we're looking at doing social media campaigns, which are great, but who are they really getting to? So we're looking here in the middle up, maybe middle, not getting to the community levels as they should, but everybody says that's a very fast way to get it. So a lot of focus is put on social media, but you still have to look at TV, radio, distance learning, health facility staff, and in the community, how to get to engage in the communities in a physical distancing way, but that they're understanding the information and they can have a feedback loop with that. Health facility staff, also very important, and distance learning for health facility staff, but also for community volunteers in the community. So taking these new approaches around digital applications, looking at WhatsApp groups, how you can use those to do the learning you need in this new environment of physical distancing. We also have seasonal messages. So during Eid al-Fitr, Eid here, we have a big, everybody returns home. So a huge part of the population goes home at that time to celebrate with their family. We had to change those messaging to delay it, and then it went from being delayed to cancel Eid, or cancel what they call mudik, going back to the your hometown, so that it wouldn't spread from the main cities to lower cities. Also, we have Eid al-Adha coming up, and I just saw today that the main religious groups have called for not doing group prayers for this holiday. So changing that messaging, so do prayers at home, not large gatherings, which is very traditional here. So the examples of the activities we're doing, I'm just checking my time here so I can stay on time and get everybody in. On radio, TV is raising public awareness. Media and infographic can kind of take that to a deeper level because you can explain more within the media and digital platforms. Community mobilization, that's really creating the space that is comfortable for the public to ask questions and that they're more engaged, involve people in the prevention and risk reduction, and so that they're participating in it, not only just receiving the information and doing it, but also participating in how to do it within their community. And then figuring out how to do that best in this physical distancing. Interpersonal communication, really focusing, working with the volunteers and the health workers so that they have the information they need to make engage their communities and their audiences, and really building that capacity so that the health professionals can manage COVID-19 within the facilities and within the communities. So looking at the overall strategy, it is integrated. So you're looking at not only mass media, community, stakeholder involvement, and then down to the family and household levels. This is just an example of one of the materials. And the interesting part of this is we really tried to show what the old behavior was and what the new behavior was. So the old behavior, everybody hung out together and they didn't have to worry about physical distance. The new ones, people are staying at house. So we're telling people that we say jog, which is physical distancing, stay at home and celebrate with your family, not with your friends. And also the second part is if you're going to socialize with your friends, you can do it over other electronic media, not by hanging out with everybody. And this was done actually before masks became mandatory. So this is also something that needs to change in looking at people having masks. And just real quick, lessons learned. This is a kind of a global review we looked at, and coming from the family planning for social behavior change, but this is really applies to all areas in what we're dealing with COVID and communication generally. It's really continue to maintain high quality of communication, clear, engaging, and with cues on action. So doing what we've always done and keeping it very good quality. Ensure message resonates, so are people understanding it? Are you pre-testing your materials so that we understand what people understand from the messages and what they're getting from it? Provide calls to action that are practical in the reality of the new daily lives. So what can people do? How do you make that call to action clear? They wanted to change here in Indonesia, hand washing to 60 seconds, but there was no proof and no WHO didn't change their guidelines. So why would you want to tell people in 4 months, 20 seconds, and then change it to 60 seconds when there wasn't any need to? So we really worked about what are the practical behaviors and practical steps you can do. Find new ways of working that follow dealing with that. Also, trusted sources. So are people getting the information from people they trust? And another one is integrating COVID-19 messaging with other health messaging. So we know that we still need to do vaccinations, we still need to do well baby checkups, et cetera. So how do you take COVID-19 messages, integrate them into those other messages so we're not forgetting one or the other? And I think with that is my last slide. So thank you very much. Hope I didn't go too fast. Stop sharing. So I hand it back over.
Okay, thank you. Thank you, Robert. Elizabeth directs the program, and it is a 5-year project funded by the US, by USAID, and its intention is to lead to social and behavior change around the world. Elizabeth has worked in this space for more than 30 years, 26 of those in Africa, and she has led various teams, served as a chief of party in places like Zambia, and has also worked on projects touching on infectious diseases such as Ebola. So welcome, Elizabeth. You literally have the last word. Welcome.
Thank you so much, and thank you to the entire Infotrak team for the invitation to come and present and share with you a little bit of my experiences and my perspectives. I know we have run very, very late. I do have a number of slides, but I will probably gloss over some of them because some have already been talked about and some we just don't have time to go into the details. Let me see. But I wanted to start with just basically like a working definition of social and behavior change, because we have been talking about communication approaches, and I think it's important to recognize that when we're thinking about behavior change and thinking about the specific behaviors associated with COVID-19, we may want to broaden our views beyond communication, as which is one of the primary tools, but not the only tool. So broadening the definition to social and behavior change, remembering that we're integrating a number of different methodologies and always wanting to develop solutions that are tailored to each unique behavioral challenge. I also had a little sidebar because I've heard a few people interchangeably using the terms communication and communications with the S at the end. And for me as a communication professional, I do find a distinction, and I think of communication without the S as strategic communication, which includes things like risk communication, crisis communication, and the piece that we find within social and behavior change or social and behavior change communication. Communications with the S is something I have found seems to be more oriented towards public relations, journalism, that perspective of getting information out to people, which is critically important, obviously, but we'll see in some of the other slides about where that distinction between just getting the information out to people versus the perspective of trying to get people to change their behavior. So just a reminder that that social and behavior change toolbox includes quite a number of different kinds of tools. Social and behavior change communication is one of the tools. We also heard Dr. Mwanganji talk about community engagement or community mobilization. There are other tools using market science or behavioral science. Social marketing might be another tool, and there's some illustrations of the applications of social marketing with some of these behaviors on COVID-19 as well. The other important aspect from thinking about social and behavior change is that we always want to make sure we have a theoretical foundation. And I've illustrated a sample of the theories that apply when we are thinking about risk communication or communication in the context of a pandemic. So I'll just give a brief description of a couple of these for you. The theory of reasoned action is the one that really is that comes from the 1960s and really is one of the very basic early theories that is a foundation for our work in social and behavior change. And that's where we just started to think about and talk about the things that were the motives for action, the messages that might change attitudes, and that really beginning to focus on an intended audience and understanding who the audience was. Rob has already discussed the extended parallel process model, but within that model, we can think about things in that sort of matrix of high threat and low threat, and high efficacy and low efficacy, and really emphasizing on the point that we want people to achieve that moment of danger control, which is where they feel a high threat, but at the same time, they feel a lot of efficacy to be able to do the things they need to do to manage the threat. So that's what we really want to focus on. And I know a lot of people have had a lot of anxiety about all the threat or fear-based messaging, but there is a role for it as long as it's well partnered with the efficacy messaging as well. There's a lot of history of the application of that from HIV and from Ebola, and these are a couple of examples where there is a bit of threat message in there. HIV will weaken the body, or Ebola is deadly. But the efficacy message is in there as well, that you can, begin ARVs so that you don't have your body weakened, or there are a number of behaviors to prevent Ebola. Another model that we often use in social and behavior change is this Pathways to a Health Competent Society. And this looks quite complicated and is going to get even more complicated in the next 2 slides. But the point being that if you think through critically all these different underlying conditions, the domains of communication, the outcomes you're trying to achieve, those behavioral outcomes, and what they will lead to in terms of sustainable health outcomes, it can help you have a very strategic approach to the work you're doing. So this is an example where we started to build out the pathways for COVID prevention and response. And again, as I said, you get more and more depth in it as you go through the process of developing out the model. But what I wanted to emphasize in this particular case is thinking about the relationship to data and measurement and study, and the importance of having the data to build into your model so that you know what you're trying to achieve, what you're trying to change, and you're able to measure it and determine that you have in fact changed those things, or if you haven't, to dig into the why not. And then the last model I wanted to touch upon is this the FOG model. And within that model, BJ Fogg has this behavior grid. And what I think is particularly insightful about this model is talking about different kinds of behaviors. There are DOT behaviors, which is a once-off, like go and get your child vaccinated. You do it once and that's done. And then at the other end of the spectrum are the path behaviors, which are the things that you're asking people to change forever, such as eat a healthy diet or stop smoking. But with COVID-19, what I think we are dealing with are span behaviors. And we don't commonly spend very much time thinking about span behaviors, but those are the behaviors that people are expected to do for a period of time. But we think at this point that we're not expecting people to adopt those behaviors forever, such as mask use. We're thinking mask use will be for a period of time. Stay-at-home messages are for a period of time. And so thinking about span behaviors, we have a slightly different perspective than we do for a DOT behavior or a path behavior. So again, that's another nuance that we want to be thinking about as we are looking at our social and behavior change activities. So a few challenges to highlight, which I think you're probably all very familiar with, but we started the presentation with the Infotrak data, which was fantastic. And it's great to have that data, and more and more data is starting to come out. But as we initially started this work, we had such a lack of data. And that was combined with changing guidance. As Rob mentioned, you know, we keep learning more and more about this outbreak or epidemic and this disease. And as the guidance changes, unfortunately, we're undermining trust. And trust is such an important element when we are thinking about social and behavior change, especially the messages and the source of messages. And then another challenge is this indeterminate length of time. I just talked about the span behaviors, and we're asking people to adopt these span behaviors, but we can't tell them for how long. And so I think that adds to the challenge. And then we also have some behavioral specific challenges where some of the behaviors are familiar, like hand washing, as opposed to others which are relatively new, like mask wearing. Some behaviors require tools, masks, some require new tools, some require known and existing tools like soap, some don't require any tools at all. So we have this spectrum of behaviors that are from structurally easy to structurally more difficult. And then another challenge we've seen, certainly in the US, but I think in many countries, is this politicization of the behaviors, and that adds to the challenge. I wanted to touch also on the stages of behavior change or steps to behavior change, and Wilfred had mentioned something, I think this is what he was referring to, on moving people up the staircase. And this, I think, is always a really useful model to help us think about where people are. And when I say people, I mean we have to break that down into our audience segments, of course. And so prior to COVID, there was pretty much zero awareness. But as information has gotten out, different segments of the audience have moved up this staircase to the point of action and even advocating for others to take action. So this helps us segment our audience on where they are in terms of their stages of behavior change. And another way of looking at this is the hierarchy of communication effects. And we can, through research, understand where people are in terms of being exposed to the message. Normally we'll have quite a high percent exposed to the message. And of that, a smaller percent will actually understand the message. An even smaller percent will approve of it, even smaller percent will intend to act, and then of course the smallest percent that will actually act. So why am I sharing these couple of pieces of information? It's because there are some things that we know that can help improve moving people along those stages of behavior change. And we affectionately call this the 7 C's of effective communication. I'll just quickly go through them. We have command attention, clarify the message, communicate a benefit, consistency counts, cater to the head and to the heart, create trust, and call to action. So how do each of those work? Command attention gets us to make sure that more people are exposed to the message. If we have some kind of a message that is very attention getting, more people are going to remember it and be exposed to it. So that's the first one. Second, clarify the message. Make sure that whatever we're saying is absolutely clear. And when it's clear, more people are going to understand it. Convey a benefit convey a benefit will help people approve of it more. If we have explained to people what the benefit is of adopting the behavior, then they're more likely to approve it if they agree with that benefit. Similarly, consistency counts. The more consistent we are in our messaging, the more likely people are going to be to approve it because it's not contradictory. Cater to the head and to the heart. That's the emotional appeal and the logic appeal. And when you appeal to people's logic and to people's emotion, they're more likely to intend to act. And create trust. If we've got a trusting messenger, again, more people are more likely to intend to act. And finally, making absolutely sure we have a very clear call to action. What is it we want people to do? Then it's easy for people to act because they know exactly what the behavior is. And this same set of 7 C's fits along our stages of behavior change as well, that using each of those, making sure that we've got each of those 7 attributes to our messaging and to our materials and so forth, we can be sure that we're going to help move people along those stages of behavior change. I wanted to touch also briefly on the fact that human behavior is complicated. And so as much as communication and logic can help, we know that people are complicated. And this is just to illustrate how programs, services, messages, etc., are often designed with this, like, here's a paved pathway. We expect people to walk on the path. But in fact, people don't walk on the path. They will take a shortcut because that's human behavior. And even when we put a sign there saying, please use the sidewalk, we've provided the information and we've asked people to do it, and that's still not enough. People are still making the shortcut. So human behavior is complicated. Information is not enough. People don't always do what we ask them to do. So we have other tools in our toolbox, such as behavioral economics or behavioral science. Some people call this nudges or cues or those kinds of things that can help people remember to do a behavior, because they may have the best intention to do it, but somehow they need something to bring them over. So these photos are a couple of examples of the kind of nudges that can be given to increase hand washing. Putting footsteps on the floor, in this case from the toilet to the hand washing station. There's documented evidence that that increases people's consistent hand washing behavior. Another thing to keep in mind is that localization of the messages. So in the case of COVID-19, we're talking about asking people to stay 2 meters apart in the case of physical distancing. So these are a bunch of examples I just pulled off the internet where people localized it using something that showed what that distance looks like. If you're in, I don't know if that's Canada or Finland, but a caribou, it makes you be 2 meters apart. Or in Florida, an alligator, it might be 2 meters long, the space of a bicycle or the space of a llama. So those kinds of examples of helping to localize the message in a way that makes it easy for people. I think we've also seen a lot of debate about mask use, and these are a couple examples. One, to help people understand the risks associated with not wearing masks, and the other to talk about how to wear masks properly. I think we will be sharing the slides, so I'm not going to show this video right now, but it's an example of a public service announcement that came out of New York. They had done a whole campaign, a competition to get people to develop spots on consistent mask use for New York City after their outbreak, the peak of their outbreak. So I encourage people to look at that later. But also just to mention that there is an initiative for a World Mask Week coming up, August 7th to the 14th. And I encourage all the partners here who want to get engaged with World Mask Week. I think Infotrak will be sharing more information about that following the webinar. I'm very much running out of time, so I have just a few last points I wanted to make. One is about preparedness, and another about coordination. And one of the keys to preparedness is having your coordination systems in place. And I was so pleased in the first presentation to see the slide with the RCCE committee and the coordination structures that are set up in Kenya. Hopefully see those going all the way down to the local levels. In the joint external evaluation that WHO did in Kenya, they show there are 6 elements to that: risk communication systems, internal and partner coordination, public communication, community engagement, addressing uncertainty, and capacity building. And so I hope that that the risk communication group in Kenya has gone through and thought through all those elements to ensure they're all in place for the Kenyan response to COVID-19. And finally, I want to close last 2 slides with some resources that are available. The COVID-19 Communication Network, and the links will be available, is a resource with all kinds of materials, tools, and resources that are available. And please also, I encourage you to upload the Kenyan materials and resources to the collection. This is a vetted collection, so it is a curated collection, so it includes really good examples that are there. I also want to flag the synthesized guidance for COVID-19. I think everybody's discussed how difficult it is to make sense of the guidance coming out from WHO, et cetera. So this synthesized guidance brings it all together in one cohesive place for people. And finally, on the COVID-19 communication network, there are a number of technical briefs that I hope you will find of some use as well. So asanteni sana, and my email address will be made available to people. Feel free to reach out should there be anything. Thank you so much.
Thank you, Elizabeth. I believe that has tied it up all together. Before we end, maybe I'll just let Angela come in and say something before we conclude. Angela? I guess I will take this opportunity to thank all of you who joined us today for what I believe has been a wonderful, wonderful engagement. I take this opportunity to thank my eminent panelists ever so much. Thank you very much. I believe the views you've given us today have left us in a better position in terms of what it is we need to do in terms of how we communicate the issue of COVID-19 to the public. We have received all your questions. Unfortunately, we will not be able to have the question and answer session, but we will get back to you. We'll write back to you, send the answers in written form, and the presentations will be collated and shared with everyone who registered. Thank you all very much. Angela, do you want to say something?
Walter, thank you. I think we are, most appreciative of all the panelists that we've had. I think the discussions have been extremely, dynamic and interesting from the broad spectrum, from people who do communication to those who do communications with an S, as Elizabeth so rightly put it. I think the questions abound are, how do we enhance the private-public sector partnership? And I think that is a question that has been asked of many. Can we get a steering and stakeholder committee that is incorporating national government, county government, communication and communications professionals and practitioners, and the public health communication specialists, especially the ones from Johns Hopkins, who already have these blueprints that we can customize and use so well in our developing countries. So my challenge to everyone is, how do we move forward and ensure that I see UNICEF is here with Rosalind, I see UNDP, I see USAID here, I see various extremely well-versed communication specialists. And the question therefore is, can we work together to ensure we come up with a COVID communications blueprint and strategy that fits every single Kenyan in one way or another and can be an anchor, and then can be used to leverage for different communities, different counties, different audiences, different socio-economic groups that can then benefit from the communication, and that it then results in us saving lives. Thank you, Walter.
Okay, thank you, Angela. Thank you all very much.
Walter, back to you. All the presentations and preparing a report. Skills and our various competencies to help our country fight this very vicious pandemic. I want to really take this opportunity to thank experts, Rob and Elizabeth. Words cannot express our gratitude. I would also like to thank Fred Rariewa, who actually made it possible by connecting us. I want to thank USAID for allowing this to happen. I want to obviously thank our national government, the CAS. I would like to thank the Council of Governors, who was represented by Ms. Jackie Mogeni, PRSK represented by the President, Dr. Wilson Marube. I would also like to thank Editors Guild that was represented by their President, Mr. Churchill Otieno. And finally, Harry Mwagona, expert communications specialist. Thank you so much for your very enlightening presentation. And yes, your rallying call is true, that what we need to definitely do is get everybody on the table and actually get and we need to actually get through the noise and ensure we can still communicate in a manner that will enable people to listen and motivate, as opposed to create fear in people, taking up the correct behavior change. Asanteni sana, have a nice evening. I apologize for some of the technical hitches that we've had. As a researcher, I think now is the time for me to start learning about technology a bit more. It's become the new normal, so forgive me for that. But I hope that you have all found this webinar extremely